and for his leadership on all issues related to health, but in particular on autism. I do want to thank Speaker Boehner and Majority Leader Cara for bringing the bill to the floor. Without them, it wouldn't be on the floor today. And Energy and Commerce Committee Chairman Fred Upton, and of course, again, Chairman Pitts. And I want to thank my good friend, Mr. Doyle. We have worked on this for well over a decade. We formed the Autism Caucus. It has over 100 members. It is totally bipartisan, and it has been a pleasure to work with him, and I thank him for his leadership as well. Mr. Speaker, I do rise today in support of this bill, H.R. 2005, the Combating Autism Reauthorization Act of 2011, I should say. This legislation is critically important to continue without interruption the progress that has been achieved to date in understanding autism and in developing interventions that will have the greatest impact in helping individuals affected by autism or other developmental disabilities. When I first got elected in Congress in 1980, Mr. Speaker, the autism community accepted that autism prevalence rates in the United States were something on the order of 3 in 10,000. Today it's estimated to be 1 in 110. And in some places like New Jersey, the data suggests 1 in 94, for a total of about 1.5 million individuals in the U.S. who are suffering from autism. On May 31st of this year, I chaired a hearing as chairman of the Global Health, Global Human Rights Africa Subcommittee, a hearing entitled Global Autism, a Developmental Disability Pandemic. My committee received testimony that some 67 million people worldwide suffer from ASD in the world, about tens of millions in Africa, according to the World Health Organization. It is an epidemic. And this bill, this legislation, the Combating Autism Act, is a very responsible and I would suggest modest effort to combat this pandemic that's occurring. In 1998, Mr. Speaker, for the record, the wonderful parents of 2 autistic children in my district, Bobby and Billy Gallagher, asked me to look into what appeared at the time to be an autism prevalence spike in Brick Township, New Jersey. I invited CDC and the Agency for Toxic Substance and Disease Registry, or the ATSDR, and others to investigate. And not only did their probe show what appeared to be elevated numbers of children with the disorder in Brick Township, but the data strongly suggested a much wider problem than anticipated in other parts of my state, because they were doing comparisons, and the data calls produced information that said, uh-oh, we have a problem not just in Brick, but elsewhere. In direct response to that, in 1999, I introduced the Autism Statistics, Surveillance, Research, and Epidemiology, or ASSURE Act, to establish centers of excellence and create a federal advisory committee, which became Title I of the Children's Act of 2000. I always want to thank Chairman Bilirakis for including it in his bill, and it made all the difference in the world. 5 years later, the initiative was reauthorized and expanded in the Combating Autism Act, the law we respectfully ask members to renew today. According to the NIH, autism spectrum disorder, and just for the record again, autism is defined as impaired verbal or nonverbal communication skills and social interactions and restricted, repetitive, and stereotyped patterns of behavior, ranging in impact from mild to significantly disabling. It ought to be noted that the Combating Autism Act of 2011 will continue the success of the CAA of 2006 by authorizing funding for programs at NIH, CDC, HRSA for 3 additional years. I would point out, and this is important, autism spectrum disorder is very expensive. And again, efforts made to mitigate its prevalence and to treat with early intervention those who show or manifest signs of it is not only humane, and that should be our driving force, but it is also very cost effective. It's estimated that ASD costs per year is between $35 and $90 billion with a B. So the costs are very, very large. H.R. 2005, as my colleagues I know have said, would also reauthorize the Interagency Autism Coordinating Committee, or the IACC, a panel of government and public members tasked with coordinating all ASD-related activities within HHS, as well as developing and annually updating a strategic plan for ASD research. In order to enhance the quality, efficacy, and applicability of research grants, in other words, let's spend the money wisely, and to avoid waste and duplication, the IACC has crafted 3 strategic research plans, one in 2009, one in 2010, and another for this year. For example, in 2009, the strategic plan included 40 research objectives, including development of new diagnostic tools, identification of genetic and environmental risk factors, and assessments of services for people with ASD in all ages in a community setting. It should be noted that the aging out issue is becoming increasingly a concern. What does a parent whose son or daughter, or sons or daughters, turn 21 and the full array of those services are no longer available? What do they do? Recently, I had Chuck Colson's daughter, who wrote a book called Dancing with Max, a wonderful story of love between a mother and her son. Her son now is aging out, and she is frightened by the prospect what happens as she gets elderly and those services are not there. We need to be focusing on that. The 2010 strategic plan had 32 new objectives, including health disparities in early diagnosis and treatment of co-concurring conditions such as epilepsy, sleep, and gastrointestinal disorders. The 2011 strategic plan added another 16 objectives, including studies on the use of accessibility of alternative and augmentative communication tools for nonverbal individuals. I just want to say to my colleagues, and I have much more that I will put into the record about how important it is, but all these different agencies of governments are surging to try to combat autism. We need to reauthorize this legislation. You know, the CDC's got its Learn the Signs, Act Early. My friend Mr. Butterworth earlier mentioned the fact that minority communities have been left out, or diagnoses are often not done in a timely way. That is absolutely true, and more needs to be done. The programs are in place. The policies are in place. We need to continue what is truly a very, very effective use of the taxpayer dollars to help these autistic children. There's also the problem, as the information has learned, early detection is key to mitigating the impact of autism. But still, even with 10 years experience educating doctors and parents and educators, there is still about a 2-year lag when there's a detection of something is wrong with my son or daughter before that diagnosis is actually made. And the earlier we start the intervention strategies, the greater that child will have a quality of life and a life where they can achieve their goals and their dreams. But if we don't catch it early and begin taking action, very often the life of that child is more seriously impaired. This legislation, like I said, is a modest step, but a very crucial step. And I want to thank all the organizations for the work that they've done. They've been tremendous. The NGOs that are in the community, Autism Speaks, all of the groups for the work that they've done in educating members. And again, thank you again, Chairman Pitts, for bringing this bill to the floor, and to Eric Cantor for scheduling it and for ensuring that we can act on this in a timely way. And again, my good friend on the other side of the aisle, Mr. Doyle, for his leadership.
The gentleman from Pennsylvania.
Yeah, Mr. Speaker, I want to thank my friend Chris Smith for